Hi everyone, my name is George Fenton. I am the Chairman and Chief Executive of the Humanitarian Logistics Association, and glad to be back with you today for this session on market systems, market analysis, and the importance of local markets particularly. We are going to have a great discussion today. We've got some expert panelists who will introduce themselves in a second. And I think that what we want to be able to do is to figure out how we can better work at the local level, particularly in the given COVID crisis. But historically, we can think of many instances in the past where disasters have been responded to, particularly sudden onset natural disasters, but also conflicts where the international community has mobilized very quickly, often very effectively, but without regard to the availability of products and services in the local markets that are able to get up and running again after a crisis quite quickly, and more quickly than perhaps was originally intended or envisaged. A good example of that was the Haiyan typhoon response, where in Tacloban in the Philippines, there was massive devastation. The international community responded very quickly, flew in a lot of supplies, but actually then realized that the markets were able to get back up and running very quickly, but in some cases they had been destabilized or impacted economically in various ways. So that would be one thing that we might want to talk about in a bit more detail with the panelists. So I would like to offer the opportunity for each panelist to introduce themselves briefly. And before doing that, we want to thank our sponsors, UPS Foundation and Chemonics here, without which we wouldn't be able to put on today's event, or indeed the event as a whole. But let me start by allowing Steve Vosti to introduce himself. Steve is currently an internally displaced person, having been affected by an actual disaster, which is ongoing at the moment. He's in California, having been evacuated because of the wildfires. So Steve, do you want to introduce yourself?
Sure, thank you, George. My name is Steve Vosti. I'm an economist by training and work in the Department of Ag and Resource Economics at UC Davis. And I've spent the last 10 years or so working with a group of nutritionists, geologists, geographers, and policy engagement specialists looking at the economics of human nutrition, particularly in sub-Saharan Africa.
Thanks, Steve. Next up, we have Claire Travers from Field Ready. Claire.
Hi, everyone. I'm Claire Louise Travers. I'm a humanitarian aid worker, and specifically, I'm a monitoring evaluation specialist. I'm here with a couple of hats on today. So I am the Global Impact Lead at Field Ready. Field Ready is an American NGO that is promoting the localization of supply chains in disasters by locally manufacturing humanitarian supplies in the field. And I'm also here as the co-founder of the Local Procurement Learning Partnership, which is a multi-stakeholder platform and partnership enhancing the relevant, timely, and effective use of local procurement in aid delivery systems. Thank you.
Thanks, Claire. Next from CALP, the Cash Learning Partnership, we have Abdoulaye.
Sorry. Thank you, George. My name is Abdoulaye Hamidou. I'm the West and Central Africa Capacity Building Lead for the Cash Learning Partnership. Agronomist and forestry option, but now working on capacity building with a background on food security, networking, and influencing activities. I worked mainly for international cooperation agencies, government institutions, national and international organizations. Now I'm in charge of strengthening of humanitarian actors' capacity in terms of cash and voucher assistance in West and Central Africa region for the Cash Learning Partnership and based in Dakar, Senegal.
Thanks, Abdoulaye. Next, cash and markets expert from Key Aid Consulting, Hélène Jouillard. Hélène.
Hello, everyone, and thanks, George. So my name is Hélène. I'm one of the director of Key Aid Consulting, which is a France-based consultancy focusing on improving assistance to crisis-affected households, looking at evaluation, ad hoc learning, as well as cash and market-based programming. And I'm also lecturing at Sciences Po and at the Manchester University on market-based programming in crisis setting.
Thanks, Hélène. And lastly, we have Alexandre Gachot from the ICRC.
Good afternoon, everybody. Good evening. My name is Alex Gachot. I work with the ICRC. I'm part of the Economic Security Unit. I'm based at the headquarters here in Geneva, and I'm the cash and market specialist for the Economic Security Unit. So I'm responsible for supporting our delegations globally, with a particular focus on West Africa and the Middle East and North Africa. And my background is in food security and livelihoods and disaster risk reduction. I've been involved in the humanitarian sector for the past 12 years. With pretty much 10 years focusing on cash and market-based interventions. Thanks for having me on the panel.
Thank you very much, Alex. So we are going to kick off with some background to market systems analysis and what do we mean by markets. And so looking at this from an economics point of view. So I'm going to hand over to Steve.
As I said, my name is Steve Vosti, Department of Ag and Resource Economics, but also working with the Institute for Global Nutrition at UC Davis. And I want to take a few minutes just to kind of share my view of markets and the evolution of markets, with particular focus on food markets, but I think with some implications for other types of markets, for healthcare services, for example, that might be relevant in the portfolio of markets that you guys deal with generally. I want to first start with, how do we think about, food markets? And I want to encourage you to kind of deepen and broaden your thinking about these and move from kind of a general discussion of food markets to food supply chains. And I'll show you some examples of what these are. The second thing is I want to probably remind everybody that the landscape for food supply chains is changing very, very dramatically. The prevalence of kind of the open air spot markets and this sort of thing is dropping very, very dramatically. On the other extreme, e-markets for foods and commodities are increasing very, very dramatically as well. And so it's a very changing landscape. And so when you think about the effects of different disasters on markets, or how you can better prepare markets for natural disasters or responding to natural disasters, think broadly about this and the changing nature of these markets that are changing sort of on their own, in a sense, in response to institutional and economic incentives. There's all kinds of sources of shocks of these markets. We look at them all through the lens of supply and demand. And these are weather shocks, natural disasters, sometimes man-made disasters. All of these can have implications for incomes, or people's livelihoods are undermined, and therefore disposable income goes down, and almost always has at least short-term implications for relative prices. And so these are the lenses that we use to look through to the final impacts. And there's information and tools to predict the direction and magnitude of these changes. And so economists have been putting together supply-demand models for years, and those can be tapped to better understand and predict the affected implications of disasters of one magnitude or another, and as well as their spatial locations. We also have information and tools to predict the impacts. A lot of the work that I have been doing over the past 10 years is predicting the impacts of policy changes and, to a certain extent, policy failures on nutrition and other outcomes. And so we have tools that can help us prepare for these things and predict, and also to target interventions if need be. We need to remember there's winners and losers associated with all of these shocks. As uncomfortable as we may be with that sometimes, it is true. And the fundamental question, and this is what I pose to all of my students on the first and the last day of every class I teach, is if you don't like what you see, what specifically do you propose be done? And we'll get back to this in a second. And finally, and sadly, I guess sadly, the effects, we're learning a lot about the resilience of food markets and food supply chains to COVID-19. I'm going to share some recent research that I and others have done looking into this. And so you can see what the potential effects of the pandemic per se have been, but also the policy responses to it, both of which can move supply and demand curves, if you will. As you think about broaden your thinking from markets to food supply chains, it's quite important to characterize these, and it actually turns out to be very useful to do so. Here are some recent work by Tom Reardon and his colleagues that have been looking at how to kind of characterize these markets, and they fall into essentially three categories: the traditional markets, the transitional markets, and modern markets or food supply chains. And here are the characteristics that they have identified as some of the most important in determining which camp these markets may find themselves, or the food supply chains may find themselves. In the context of this traditional markets, it turns out they're actually very small in terms of percentage of total kind of food that is delivered, and that's been kind of on the decline for a number of years. They tend to be very small enterprises. The supply chains tend to be very short and local. There's no contracts and standards, and they tend to be very labor intensive. Much more prevalent in the context of developing countries are these what we call transitional. And these are the small and medium enterprises, including kind of wet markets where people get together. The linkages tend to be much longer and primarily between rural and urban areas. And so these are the kind of rural-urban linkages that are becoming, to a certain extent, more exposed to kind of public standards. They tend not to have as many contracts, and they tend still to be fairly labor-intensive. Increasingly important and sometimes predominant in some food supply chains are these modern markets. And these are the supermarkets that are linked to large processors. These markets go all the way to international links, and I'll show you an example of that in a second. And these are usually contract-driven, and they tend to be relatively capital-intensive. Now, what happens is, depending on the type of food supply chain that you have characterized in the areas of interest, you will get very different responses to shocks in the short, medium, and the long term. And that is very important to know in terms of kind of predicting your interventions, but also understanding the potential consequences of your interventions on these existing markets. This is an example of price movements. This is from the famine early warning system in one region of Haiti over the past year. And we were particularly interested to see what was going on after the pandemic began. In Haiti, it was about the 1st of March. And what you see is that two very different patterns here. On the one hand, you've got yellow maize, wheat flour, and rice that are fairly modern markets that have links to international suppliers, etc. Very few differences here. On the other hand, this is for black beans, which is not traded internationally, and it really depends very much on local markets. And these are traditional in the sense that there are lots of small-scale producers that provide these things. And what happens in this particular case is back in September, they had the beginning signs of a fairly bad agricultural year. And once the pandemic began, then in fact, you get a fairly dramatic increase in these prices. And so different food supply chains give you very different answers to the question, what would be the likely implications for these shocks? Now, economists have a kind of a list of things that you should be careful to consider when you are thinking about taking action, any action on any front, including investing in markets or market development. And I'll go through these very quickly, but these are the sorts of things that we pay attention to. If we have natural monopolies, if there are important externalities, if there are public goods involved, asymmetric information is quite important. The completeness or not of markets is very important, and poverty and merit goods are going to be of fundamental importance as well. I want to highlight two for this discussion, which is public goods. And these are the roads, infrastructure, security, and those sorts of things that the governments really do have a comparative advantage in providing, and markets have a very difficult time in providing these because it's so hard to kind of charge for them. And asymmetric information. This is where some groups of producers or traders or folks, even consumers, have access to some information that other people do not. And that can be very disruptive to markets. Now, part of the discussion that we always have is, well, let's strengthen these markets. But what I always challenge everybody to think about, what exactly does this mean? You know, given the nature of the markets, the evolving markets that we're seeing in the context of developing countries. Second, you know, why do we want to do this? What is the expected objective? How will we measure the gains associated with investments that are made in the name of strengthening markets? How will we know when we've succeeded? And what sorts of investments should be made, and who should make them, and who should pay for them? These are kind of standard kind of academic questions that we pose to all of our graduate students, but also to all of the policy folks and those who advise them when we begin to discuss any of these investments, and investments in markets are among them. Our mantra in all of this, our being the economists, is that let efficiency be your guide. Net present value is the proper conceptual framework. It's hard to do sometimes to measure the value of the benefits that accrue to different interventions in markets. But cost effectiveness is a very, very good start and can be used to make these assessments. Finally, some minimal data sets for assessing these markets. You need to know, or probably should know, what the nature of these markets are before and during and after these crises, and how they would be affected. As suggested earlier, there's some market characteristics, these categories that we've used before. The length and the connectedness of these markets and the scale economies along the food supply chain are all measurable and can be very useful in kind of assessing the extent to which both shocks will disrupt these markets, but also the extent to which your investments in them may pay dividends. There are other things that you can look at. You can look at marketing margins and other sorts of indicators of efficiency of supply chain, food supply chains. And there are also really important impediments to market development in terms of infrastructure, legal impediments, availability or not of credit. These are core things that you can discover before you ever go to a place, or keep an eye on once you happen to be there. In many cases, the advice of government is stay out of the way. Do your job in terms of providing the public goods that are required for markets to actually develop in more kind of commercial and efficient ways. And that's it for me.
Next up, I would like to invite Claire to perhaps reflect a little bit on what Steve was talking about and share her ideas. Thank you.
Thank you very much, George. And indeed, thank you to the Humanitarian Logistics Association and all the other organisers for this event. So as I mentioned previously, I'm a humanitarian aid worker, and I think that's important to mention because I'm not an economist. I'm not a supply management professional. I'm a practitioner of aid, and specifically I have an interest in market-aligned approaches to aid delivery. So that's been such an interesting introduction from Stephen, because I think it really lays a good conceptual framework for what we're talking about. But when a crisis hits, how do you activate that into a meaningful understanding of how you're going to support a market system towards an early recovery, which is obviously what we want in a situation where there is either a stress or a shock to a market system. And when we manage to do that effectively, we have options to align our aid to the market systems. By that, I mean that once we have a market systems analysis that is suitably clear and concise and has been able to be sort of done quite quickly, we're able to opt for a much larger range of types of interventions. One of which I know will be spoken about by Abdoulaye later is the cash voucher assistance, which is used quite a lot now. I would say it's becoming quite normal to be using cash, either as well as or instead of largely food delivery. But when we're looking at the market methodologies that we have as practitioners, and there are a handful of robust methodologies that are used globally and have a long history and a good community of practice behind them, the market assessment methodologies tend to focus quite heavily on agri-market and food market indicators. And I think what becomes clear is that misses out a really large part of the picture, non-food items. And while there have been some documented cases of cash being used for specifically shelter and non-food items, we don't have nearly the same level of rigorous methodological research or case studies about how market systems analysis can include that part of the markets. Because these market assessments then cannot adequately capture all of these supply chains, we end up having to defer to global importation of often very, very large amounts of non-food items. And we've heard a lot through this conference, including from the keynote speaker today, how sometimes this can be almost like a double shock. NFI provision by aid agencies after a disaster can often further destabilize a recovering market system, can delay a market recovery, because the local vendors of those products cannot hope to compete with the large-scale provision of either drastically reduced items or free items. So, for example, Field Ready has observed this a lot in the Pacific Islands, where Field Ready has been working for the last 7 years. They have the cyclical nature of cyclones there. So when there is a shock, like often to these public goods that Stefan was talking about, this is where it's really felt for some of the local manufacturers, is that the roads are washed away, sometimes the raw materials may be affected, or their own supply chain is affected. But this doesn't mean that they cannot recover. And I think your last point, Stephen, really resonated with me, was sometimes we just need to stay out of the way and let markets recover. But that's not what we do. We rush in, we want to do no harm, and we want to help. And we end up importing a huge amount of goods into a small market, flooding that market. So, for example, in Vanuatu, we've seen now there is no national soap making industry. It's simply not there because we've seen a huge importation of these free soaps as part of a hygiene kit. And when you have a couple of free bars of soap for every single household, you can see how that can really affect the businesses, the small businesses that are actually there providing those as local suppliers. Obviously, that's just one anecdotal case study, and as I've mentioned before, there is a lack of proper research and case studies about the impact that this sort of flooding of the market with non-food items can do to a local market recovery. But it's also important to note that this is something that we are capturing a little bit, because these markets are not drastically different from our beneficiaries. These people are the livelihoods that we are talking about when we're doing food security, livelihoods recovery. I think I have a couple more minutes, so I also just wanted to speak about the NFI provision that Field Ready is doing. So at the moment, when we have a system that sort of preferences globally procured standard items, we lack the ability to make them context specific. we lack the ability to tailor those items to what might be best for the local need. And we've made great strides, I think, as a sector in pre-positioning the items that we believe will be most relevant and needed. But it can still be that the incorrect item, or should we say the least ideal item, could still get into the hands of somebody. Whereas there may be a locally manufactured item that would better suit those needs. We're also looking at very long lead times for a lot of these non-food items, expensive transit, environmentally unsound waste. And I feel like this is where Field Ready's best value is. They are promoting the local manufacture of aid items in the field with local producers and with digitally fabricated and designed goods, which is something that they did during COVID. So during COVID, Field Ready activated a large network of digital innovation hubs or makerspaces, which were able to start producing face shields, goggles, and I believe masks quite quickly. And this was, sharply needed because, as we've heard, I think today's keynote speaker mentioned it, there was a lag in the PPE right at the very beginning. Thank you very much for having me on the panel. I'm really looking forward to continuing this conversation. I want to keep it back and forth, so please do drop your questions in the Q&A. And back to you, George. Thank you.
I think our next panelist, Abdullah, is going to focus a little bit more on the current COVID crisis and how that's impacting public health supply chains.
Thank you very much, George, and all the organizers and all involved in the organization of this very important event. Yes, we are, as I said in the introduction, we are working around cash and voucher assistance. When you say cash, you say market, but I think we should keep in mind that cash cannot solve everything, and it's similar for any kind of modality. You cannot say that because you are in this or this situation that necessarily you need to use or do not use this modality. Each kind of modality you want to use should be like feasible to keep a recipient secure. So you should take into account everything. But on the same time, cash and voucher assistance can help, like, to give a kind of lever in terms of access, specifically in this situation of COVID, when in most of the country you have lockdown, limitation of movement, and big impact on business. So in this situation, people perhaps don't have like the regular income or business income, something like that. So in that case, giving them cash or voucher can help a lot in terms of access and in terms of preventing some diseases which can be linked, for example, to a specific food items, something like that. But on the same time, as we are talking about markets, yes, cash, when we say cash, we say market, but don't consider market assessment only for cash and voucher assistance. You should normally consider, even if you are intended to deliver your project through another modality like in-kind distribution, you need to look at the local market, how your intervention could potentially impact positively or negatively the local market. But to come back again on the specific context, like in this COVID-19 situation, health markets, particularly in West and Central Africa region, are facing a lack of basic capacity in terms of infrastructure. staff capacity, something like that. And they are often informal. So giving cash is not necessarily enough. Perhaps we need to look at this side, how we can strengthen the capacity of these healthcare services and infrastructure when we want to support people in need in such situation. And we have seen in the region, but perhaps probably more broadly around the world, the role of the social protection system in this COVID-19 situation, when we have more and more, it's not necessarily the link between the humanitarian cash and voucher assistance, but most of this social protection program, social safety nets, play a key role in helping people in this COVID-19 situation in our region. And in addition, we have seen the growing interest and engagement of the Global Health Cluster on cash and voucher assistance, which is now becoming a tools of action for all the cluster actors. And the Global Cluster, Health Cluster, have recently published a guidance on the use of cash and voucher assistance in health sectors. And to finish, I can say that a crisis or disasters don't necessarily have only negative impact. We are talking about market. So crisis or disasters can create new opportunity for market actors. They can review, they can create new opportunity of business. This is why as humanitarian actors or development actors, if you want to deliver your assistance, you need to look at the possible negative or positive impact of your intervention throughout the process of response analysis. Yeah, I think that is what I want to share, but we can continue the discussion. If you have any question, we can drop in the Q&A. Thank you.
Thanks very much, Abdoulaye. Yes, good points raised. And as you say, if anyone has any questions, please drop them in the Q&A. Okay, so next, I think we have on our panel Hélène to share her vast experience.
Thanks, George. Brilliant. And I'm going to talk about market-based programming and trying to zoom in the health sector. Because I think assessing the local market environment to design program has become a commonly agreed upon good practice in the humanitarian sector. So it started, as the panel, by the way, it started with the food security sector and then got followed by shelter, WASH, and now health. Cluster have produced position paper and tools to encourage such market analysis. And as mentioned by Abdoulaye, such analysis is relevant irrespective of the modality you envision to deliver the subsequent program. So be it cash, voucher, in kind, it is important to be market aware, so to speak, because there is no program which has no impact on local markets. And the analysis of commodity-based market system is fairly straightforward, and numerous tools exist to do so. But health programs rely on a variety of market systems, and some of them are service-related, which has typically proven more challenging to assess than those who are commodity-related. And market system related to drugs may also present specificities, right? Be it related to the regulatory environment or to risks related to quality. And so these market systems, I believe, they are called in economics jargon the lemon markets, meaning market system for which the product quality cannot be observed directly That's the case for fertilizers, but that's also the case with drugs. So this means that if there is a surge in demand for malaria pills, for instance, after a flood, it is risky to rely on a local market that have strong incentive to deliver fake products. Hence the importance to have thorough market analysis in the health sector. Another set of health-related risks, before I jump into the opportunity, when it comes to market-based programming in the health sector, that health practitioners are considering, and that I think are important to put on the table. So it's this tension in terms of risk to public health, and how the providing beneficiary choice via the use of cash and voucher assistance, for example, doesn't negate the responsibility to ensure access to health goods and health services that meet minimum standards. And so one thing that is important, and that Abdullah also flagged, is that cash is not a silver bullet, right? And so distributing cash to households will boost their capacity to purchase health products and services, but it's not necessarily going to have an effect on their willingness to pay for such goods and services. So it's really important to complement cash distribution with social marketing, behavior change to boost the demand for quality product and services. And there is another risk, so to speak, that health actors are often sharing when it comes to relying on local markets, is the risk of monetization of public goods. So primary healthcare in emergency setting is to be provided for free, right? That's the rule, and this is what a lot of health actors are doing and advocating for. And so here, from a health practitioner perspective, there is a risk that market-based programming is perceived as monetizing public goods that should be freely accessible. And so here, I think that the humanitarian communities should have a very pragmatic approach to say that, okay, right now, quality healthcare is not provided for free. So let's give access to crisis-affected households to such healthcare, which require payment, and continue to strengthen the market for primary healthcare so that in the long run, it is provided for free. So here I'm also advocating for one approach, not necessarily being exclusive of the other. So you can use local market as they are right now, but also think about strengthening or changing them in the long run. And finally, a success that's very often that cash or market practitioner may perceive health specialists as being reluctant to use local markets, but for long, without necessarily calling it market-based programming, but for long, health actors have considered the use of cash and voucher assistance to support access to healthcare. And in numerous contexts, health actors are actually providing voucher for transportation. And so doing so is also to be cognizant of the barrier that crisis-affected households may face to access local services and local markets. So this could be considered as market-based programming in the health sector and has been successful. One final point, if I may, George, is to a plea and a call when it comes to multi-purpose cash grants, because this has become a common way to deliver assistance. And it may also be effective in meeting basic health needs when part of a sufficiently resourced minimum expenditure basket developed with the input of health specialists. And this last part of the sentence is the key element of it, because it is paramount that health specialists engaged in existing cash working group when they are discussing minimum expenditure basket. And so far, I must say, it has proven challenging to bring them to the table. So I'm going to finish by an invite to Cash Working Group that I do not lead, but that I'm sure for which the door is wide open to health specialists.
Okay, so our final panelist is Alex from ICRC. So Alex, over to you.
I do. Thanks again to the organizers for inviting me to join this this panel on a very interesting topic, and thanks for the brilliant insights shared previously by the other panelists. So I work with the economic security unit of the ICRC. So within economic security, we do focus more on food security and livelihoods, right? So my key point that I'd like to make tonight is market analysis, more specifically market system analysis, is a very nice way to broaden your horizon as a food security and livelihood specialist and to collaborate with your colleagues, whether they are from logistics or finance or other sectors, right? So using a market system analysis to inform relief and recovery interventions help identify synergies across sector. So I'll share an example from within the ICRC. So we have different ways of working between different units of the ICRC. So typically, the economic security unit tends to focus more on households, on crisis-affected households, right? So this is usually the unit of analysis. So whether we target them with in-kind assistance or cash or voucher, often the focus is the crisis-affected households. Other units, such as our water and habitat unit or the health unit, they tend to focus more on systems issues, typically supporting existing hospitals, right? Or supporting or repairing existing water and sanitation infrastructure, okay? So by adopting market system analysis, trying to understand first the critical market systems that crisis-affected people depend on to meet their basic needs, for example, cereals, housing market system, and I agree with what Helen mentioned earlier. When we talk about market system analysis, we often tend to focus on commodities, and except for drugs or fertilizers, some of these commodities are actually not, it's pretty straightforward. There are very good tools that have been developed, and Stephen illustrated some of them. When it comes to services, for example, housing or other types of rental, this is a bit more tricky. So you do need that system length, trying to connect not only the environment that is affecting a value chain or a market chain, but also having a close look at the infrastructure and market support services that enable a market chain to function. And among the different actors, for example, the producers, the traders, the processors, and the consumers, trying to understand the connection and the relationship between these different actors, this is critical, right? And this is obvious that somebody with only a food security background will not be able to capture, to apprehend this complex, the complexity of this network. So what I've seen within the ICRC is that in many different contexts, whether it's in Syria, in Iraq, or Yemen or West Africa, using a market system analysis help us bridge gaps between different units. An example I can provide, I'm supporting our colleagues and the National Society, so the Lebanese Red Cross in Lebanon, in Beirut, after the blast, and we're trying to use a market system analysis, trying to look at access to water and also access to power. It was a major issue before the crisis, before the blast. Now a lot of power units have been destroyed, and access to energy is an enabling factor for a hospital, obviously, but also for small businesses to operate, right? So instead of just, and often cash assistance will be needed to directly target people, but also looking at the systems and what are the critical factors that enable some activities, whether it's life-saving activities like a hospital or business activities, and power, energy is a good example. So, for example, working closely with our WASH engineer, our habitat engineer, and our health colleagues, to set up a solar power production unit in a neighborhood typically that has a hospital and that hosts a lot of displaced people. This could be an interesting market-based intervention by, facilitating access or repairing power infrastructure by reducing dependence on fuel, for example. This could be a nice market-based intervention that could benefit a variety of sectors. So next, I'd like to focus on a couple of cases that illustrate how the ICRC has been using a market system lens and market-based intervention in different contexts and different sectors. So I'll start by focusing on the ICRC COVID response. Okay, in Libya, for example, in Tripoli, our colleagues supported hospitals with financial assistance so that they could buy the required PPE. Before doing this, a rapid market assessment was conducted by our colleagues, and they realized that the required PPE was still available in local markets. So there was no need to import them and wait for 3 months, because we're talking about the peak of the crisis. Before the crisis really hit, there were emerging cases. PPE was still available. So the rapid market analysis enabled to identify this, and we worked closely with the local suppliers, and we produced a list of key items that could be purchased from the medical facilities that the ICRC supported. Another interesting example of our COVID response was supporting local production by detainees of chlorine in Bangladesh, for example. You know that the ICRC works in prisons. We knew that detainees were among the most at-risk population. We identified that there was a shortage of chlorine, and this is something that could be locally produced. So we set up programs. We worked closely with the National Society in Bangladesh, and we supported chlorine production by detainees. Okay, it's almost like a cash for work intervention. We didn't pay the detainees, but there was a system of benefits. So there was some rewards, some trainings, other things that the detainees involved in this project could benefit. And there's a similar intervention that also takes place in Lagos, in Nigeria, where the ICRC, closely working with the National Society, we supported the production of masks and detergents in the prison. Also, to prevent the spread of the disease, obviously, but the rationale was that there will be a limited availability of these key commodities, and there was an opportunity to produce them. So for me, it's a good example of a market-based intervention. And in these two cases, it was observation, it was discussion, consultation. It wasn't really, following the steps of a precise market guidance documents. It's a lot of common sense and consultation among different people. An interesting example I'd like to share with you, it's not related to the COVID response, but it's an intervention that the ICRC has been implementing in DRC, in Eastern DRC, in Bukavu, and it's called Maison d'écoute. It's basically a mental health intervention, right? We are supporting SGBV survivors with cash assistance, with counseling, and women who have been abused are part of a group of other women, and they can share the experience. Some of them received emergency cash because they had to leave their household, unfortunately, after some incidents, some violence happened. And some of these affected women are also receiving business support to start income-generating activities. So for me, it's also a good example of how market-based intervention, in that case, cash plus, can be used to provide psychosocial support to SGBV survivors. Another interesting example is around nutrition. Okay, within the Economic Security Unit, we work closely on nutrition, namely in prisons and other areas, and this is a bridge with our health unit. So the picture that I'm showing here, I only have one slide, by the way. The picture I'm showing here, it's from a pilot project that we implemented earlier this year in the midst of the COVID response. So we had to apply, physical distancing, masks, sanitizers, all these things. but we were able to implement it. And basically, we switched from commodity vouchers, which is basically almost like in-kind assistance, and we switched from this to value vouchers, enabling crisis-affected people receiving assistance to select, in addition to basic food items, they could select the vegetable they wanted to procure. And the reason we did this, based on some analysis that I helped, conduct in the field a few months ago. This area in the north of Burkina Faso, it's the area where vegetables are mostly produced. Tomato, potatoes, onions, you name it. It's the breadbasket of vegetable, right? So by doing some market system analysis, we realized that it was the main livelihood, and we collaborated with local suppliers, local vendors, and vegetable producers that were involved in this voucher scheme. And in addition to this, we also provided affected people with what we call cashback. So they had some value voucher and cashback, so that they have a bit of cash in their pockets that was typically used to buy soap and other detergents. Another example I'd like to share, it's vegetable farming. I don't have an obsession for vegetable, but I do think they offer nice opportunities to work across sectors. So we're promoting vegetable farming in hospitals, typically in the military hospital in Juba. This is something that we're doing. So this is a way to increase the supply of vegetable. There is a shortage and a poor availability of vegetable. It's quite expensive. So by producing your own vegetable, it's a way to improve the supply of vegetable for patients, actually. And we're also trying to do something similar in detention centers in Nigeria. It's not happening yet, but this is something we're trying to promote. And the last point I'd like to make, more specifically around market system analysis and supply chain analysis, it's a research project that we conducted last year with MIT. So between the logistic unit of the ICRC, the economic security unit, and we're basically trying to use system dynamics modeling for supply chain analysis. So the idea is not to, we're not pretending to have a crystal ball, but try to use a bunch of different variables to assess how market prices are likely to evolve, okay? To have a bit of forecast so that we can be more proactive rather than waiting for, crazy inflation to happen and then knowing that people receiving cash assistance will struggle because the amount that we're transferring is only covering half of what was initially intended. So I'll stop here.
That's great, Alex. Thanks
a lot
for those really good examples. And it's very, very good to see that over the last few years, there's been a real positive move and more sophisticated attention being paid to market-based interventions and the use of cash and in interesting ways. And I think one of the things that Ed Martinez mentioned yesterday in his keynote address is that the role of the logistician, the loggy, is changing pretty dramatically now. And so even the World Food Programme, for example, is talking about retail logistics and retail logisticians. So logisticians needing to have a much clearer understanding as to how to intervene effectively without disrupting markets. Really, thanks very much to all of the panelists for all of your excellent points. Going back to Steve, he was talking about ways to strengthen markets and the importance of data sets and the need for data sets to assess markets. And if you can't assess them effectively, then stay out of the way. But in terms of disaster preparedness, which was another point that was raised yesterday, I'd like to pose a quick question to the panelists. And I guess that question is, how do we make sure that we can be better prepared to intervene or not intervene from a market intervention point of view? I don't know whether, Steve, you have the answer to that question as our representative from the academic community here.
Okay, I probably don't have the answer, but it's hard to imagine interventions that don't disrupt markets to one degree or another over some time period, over some space. And so it's a real question of the extent of the disruptions and the duration of the disruptions. And I think that is what one of the key messages that Helene and Claire and others have pointed out. You know, if people are in need, there are, you know, kind of humanitarian interventions that need to be undertaken in order to save lives and to avoid diseases and things like that. And some of the local providers of, you know, soaps, for example, that sort of thing, may be displaced. This is actually very common. And the question is not, to, in my mind anyway, is to, you know, weigh the social benefits associated with the intervention with the social costs associated with not intervening and waiting for a fairly small soap industry to actually respond to the extent that they can to the humanitarian crisis. And so what we often suggest, and this is very common in the context of environmental economics, is if you want to save an ecosystem service, you know you are going to be displacing some individuals, find out which ones and sign a check to them. Is really, you can compensate some of the losers associated with these interventions. And so a lot of the information that we need in order to move forward with this is assess the extent to which there are local markets, producers that will be disrupted, identify the income consequences of this disruption, at least in the short term, and give them a check. And so this is a cash transfer to kind of an unlikely collection of folks who may not be directly being affected by the crisis, but indirectly certainly they are, because what the intervention has kind of basically zeroed out a demand for the product, a demand that will come back, and but we need to help them in the meantime. And this is happening worldwide in the pandemic that we're experiencing right now, as all kinds of transfers are going to these affected places and merchants and industries. Because a lot of the effective demand reduction was via policy fiat. I mean, we decided to shut things down. Fine, there are consequences associated with that. When you reopen, you don't want to have to reopen to a landscape that is devoid of producers of goods and services.
Thanks, Steve. Yeah, good points. Okay, so I'm going to open up for further questions. We've got a few questions in the Q&A, several from T. Kotzi. I don't know, hopefully, I'm not sure your first name, but I've asked for you to be unmuted if you'd like to ask your question, or one of your questions at least, to the panelists. So you have one for Steve, one for Claire, and one for Alex.
Yes, this is Telesila. So I know, can you listen to me now?
Yes.
Great. Thank you, George, for moderating and for all the interesting presentations. I know I have many questions, but let me pick just one so that I don't monopolize the discussion. So I guess I was wondering, as I was listening to Alexander at the end about how ICRC is providing cash. Sometimes it's cash for work, or even if it's not labeled cash for work, the example of the prisoners with the chlorine production. And I wonder, in such environments where cash is not provided as a disaster response or as emergency relief, and it's more a part of a more long-term, regular programming for the humanitarian organization. Has ICRC tried to, for example, connect with the local government? In what form? What is this a form of a partnership? What does it look like? Do they think it's important? Because in a situation where cash is given to one group versus another group in a local community, I can see how this can raise tensions and maybe creates turmoil at the end among people in the same community. So I wonder how they handle this kind of situations.
May I jump in directly? Or
Yes.
Okay, great. Thanks a lot for the excellent question. I'll try to be quick. So, yeah, most of the time, the ICRC works in conflict-affected context, right? The more long-term program that we have are typically in protracted crisis contexts, like Syria and other, like Yemen, for example, right? So some areas you have acute conflict, so the focus is much more on relief assistance because it's about life-saving. In other places, it's more about recovery, right? The programs that we have in detention are obviously more long-term, right? But all the programs that we implement, there is like intense and intense consultation with the national governments, whether it's the Ministry of Justice, Ministry of Labor, and at local level, right? And we also work in many areas that are currently experiencing conflict. So your de facto local authority might be an armed group, right? And so an ICRC, because of our mandate, because the neutrality of the agency, we do discuss, right? And there's a nuance between discussing and negotiating, but we do interact with all the parties in conflict, and we can't do anything without them being aware and then approving our action. This is the cornerstone of our mandate. And typically, what we try to do more and more, because you're right, targeting affected people, displaced people with cash, it can create tensions. Typically, if the displaced households are in a poor urban area where you also have local communities that have been affected by structural poverty, right? So usually the target, we have selection criteria, and being displaced, we use also vulnerability scorecard, right? Typically, if the head of household is a woman, maybe she has lost her husband and she's the only breadwinner, she might be prioritized for targeted assistance, like cash assistance. But what we try to do more and more is also involving the host or local community, okay? So also involving maybe 20%, 30% of the host community, of the poorest member of the local community, that might also be eligible for cash assistance. That's one point. But what we are more and more promoting and pushing is doing this market system analysis, trying to identify some of the structural barriers in critical market system, whether it's serial housing, and try to address them. I use the example of power, because if you fix power in an area, or if you set up a solar power production unit to facilitate access to energy, this is something that can benefit to displaced households, but also local communities. And the example in Beirut, I think it's a valid one. This is something we're trying to do, or repairing water infrastructure. You know, it's not like then it's only displaced people who can access the borehole, right? So I think these are two examples that hopefully help answer your question.
And we have another question from Nadia Griffin. Nadia, I think you should be able to ask your question perhaps to Claire.
Hi, everyone. Thank you so much for the presentation. Essentially, I was wondering if market disruptions are always seen as negative. This question really came up as I was thinking that in a lot of contexts that, especially in a lot of emergency contexts that NGOs and IOs operate, many things are brought in anyways. The local means they're bought locally, but they're not, or bought, they're available in the local market, but it doesn't necessarily mean that they're manufactured locally. They all come from somewhere. And if they're brought in that way, then wouldn't the opportunity to bring other types of products or similar types of products give the opportunity to the local population to experience a variety of things rather than one or two that are available in the market at a time, and or also for the manufacturers or for a bigger variety of vendors to have access to those markets as opposed to one or two in a given circumstance?
Okay, so that's a really great question, and I think from my perspective is that no, it's not de facto that every market disruption is a negative thing. It's also difficult to talk about something as a totality. So there is a market disruption. There is effects of that market disruption. One of the examples that I want to draw on is the earthquake in Nepal. And you make a really good sort of point, which is that locally procured means that it's just bought locally. It doesn't mean that it's made locally. But what we saw after Nepal obviously has notoriously a lot of public good restrictions. So there are issues with land borders in and out of Nepal, and obviously that's the only way of getting anything in and out of Nepal unless you're going to fly it in. So quite predictably, almost there were a lot of issues with things being brought in and that leading to very long lead times. That doesn't mean that there weren't necessarily items available locally, but there are questions about why you would still bring them in. The reason why I wanted to answer this question is because what happened after the Nepali earthquake was that Field Ready brought 3D printing to Nepal, initially to do, I believe, some waterworks reconstruction, and some to work with energy as well. So Alexander has already spoken a little bit about the importance of energy. Bringing 3D printing in was a completely novel concept in Nepal at the time. Nepal had one functioning 3D printer at the time, which was at Kathmandu University, which was a huge thing. You know, it's like the size of a room, 3D printing turbine blades for testing. It was nothing to do with anything to do with NGO. 5 years later, when I revisited Nepal to conduct the 5-year evaluation for Field Ready, there are now hundreds of 3D printers. There is a code in the Harmonized Tariff System, the HTS, for both 3D printers and for the filament. What this means is not only is that now a functioning market system of its own, but it also means that now you can make things there. You know, we're no longer living in a sort of manufacturing age where everything has to be made in a factory and then sent by the hundreds of thousands on a truck. We do have more digital fabrication tools than ever before, and crucially more knowledge of how to use those than ever before. And this is really what I think was Field Ready's breakout sort of spotlight, was their use of 3D printing in humanitarian emergencies. So you can make oftentimes these things locally with the right sort of technical support. And where you can't, because obviously it's not going to be the local procurement is always the best option, but maybe it's not a question of what's currently available, it's a question of what could be available. What, with the right support, indirect support, could become out of a market system disruption. I hope I've answered that question to your satisfaction.
That's great. Thanks, Claire, and great to hear what all the positive news from Nepal. Okay, so I think we are out of time. I know we have a couple of other questions, one from Caroline to Steve, but maybe if anybody has other questions, wants more information, please make sure you're on the Slack channel for this session, and you can still pose questions that way. I'm sure the panelists will be happy to answer any other questions that you may have. But otherwise, again, I'd like to very much thank the panelists for their time and the presentations that they've made, the time it's taken to put those presentations together, think about this challenging topic, and hope the audience found the discussion today useful. And thank you from me, and thank you to the team behind the scenes helping us to make sure that this session was delivered.